Well, I think it's helpful in today's medical environment to be as subspecialized as you possibly can. I think it just allows you to have a more focused area of care.
After I injured my knee, I went to the ER, and there was no conclusive diagnosis as to what the issue with it was. So I continued to try to play through it, but had issues. I talked to other athletes who had had knee problems. They recommended Dr. Nitz. What ended up happening was I tore my ACL as well as did damage to my meniscus, so I had to have ACL reconstructive surgery.
I think the most common things that I take care of are the common things, which is simply injuries to cartilage and ligaments of the knee, and then in the shoulder it tends to be more related to instability of the glenohumeral joint as well as injuries of the rotator cuff tendons.
I've had shoulder pain for about 15 years. I finally went to see Dr. Nitz, and he explained to me some procedures that he could do. And just 2 weeks ago, he did some procedures and corrected all the problems that I had had and regained that stability in the shoulder joint.
I had the opportunity to participate in a sports medicine fellowship back in the late 1980s, and during that time, it was my opportunity to work with some very outstanding orthopedic surgeons in the Indianapolis, Indiana community who taught me a lot about the science of sports medicine, but more importantly, taught me about the art of sports medicine.
Certainly knowing that Dr. Nitz was a specialist in shoulder repair was very important to me, and that he was a sports medicine doctor and he had a lot of experience with these types of procedures weighed very heavily in my decision to come to him.
I think it's an ideal situation to be able to have an orthopedic practice where you can just walk across the hall and speak to the physical therapist as they're providing care for your patients. I think there's a really good two-way exchange there. The therapists give us valuable insight. I always feel like there are eyes and ears in the process of our patients' rehabilitation course. And so being able to have that direct communication and to sometimes as many as 3 or 4 times in an office setting, be able to connect with the therapist about a certain patient's issues with their recovery has been a real adjunct, I think, to good patient care.
It's been very convenient for me to be able to come here to see Dr. Nitz, to see his physician assistant, to be able to walk right down the hall to physical therapy and to go through that whole physical therapy process. And it is really a one-stop shop where they can take care of my shoulder from the beginning and diagnostics to the end, and the end of physical therapy and having me back to full usage of my shoulder.
My philosophy or approach to healthcare is try to keep it simple. I think there's so much going on today with the internet and literature that you can get yourself involved with, but I think when it's all said and done, I try to strip it down to the easiest possible terms, and I like to think that if I can explain things in a way that's pretty basic or common, then I feel like we're going to be able to provide the approach or the right access to the treatment care that's best for that problem. And so again, that's my philosophy. I want to make it simple. If something's broke, can it be fixed? If it's not broken, is it something that just needs some fine-tuning?
I was very happy with the results. Actually, getting my wisdom teeth pulled was worse than having the knee surgery. So coming out of it, there was some rehab, but overall, the temporary pain was worth, the lifelong sort of improvement to my knee that I got from surgery.
I've had a great experience. Everyone has been extremely friendly, extremely caring. They have been extremely thorough in explaining things to me and making sure that I understand the process, and they're doing everything they can to help me recover as quickly as possible.